Welcome back. It's time for our Africa for Health report. Health correspondent Linord Moudou joins us now with some new information on tuberculosis. Welcome back, Linord. Hello.
Thank you, Vincent. Hello, everyone. Tuberculosis is a bacterial infection that can spread through inhaling tiny droplets from the cough or sneezes of an infected person. TB is most often found in the lungs, but can affect any part of the body, including the bones and nervous system. The World Health Organization says every year about 9 million people get sick with tuberculosis. However, 3 million people are not receiving the treatment they need. Many of these people live in the world's poorest and most vulnerable communities. Joining us now via Skype from Geneva, Switzerland, is Dr. Mario Raviglione, Director of the World Health Organization Global TB Program. Dr. Raviglione, welcome to the program.
Thank you very much. Good afternoon.
Good afternoon. About 3 million people do not have access to the treatment they need. Who are these 3 million people? Are they part of some specific groups, such as women, children, or is anyone at risk in developing countries not to have access to treatment?
Yeah, one thing that has to be said is that these 3 million people are the difference between the 9 million cases we estimate exist every year and the 6 million that are officially reported. So we are missing, in essence, in the system, 3 million. Now, to answer your question, yes, these are the most vulnerable people. These are the poorest among the poor that do not have the money or the capacity to, in a way, reach the health services. Or in some cases, they go to such a poor quality services that they are not taken care of in the way they should, and TB may never be diagnosed.
So how do we tackle this issue? How do we ensure that these people have some access to treatment?
Well, there are several steps here. The number one is actually, as you say, to provide access, and that requires a primary care system and services that are really there, that work, and that are of quality. At the same time, we must be absolutely considering the notion of free diagnosis, free treatment, or as cheap as possible, depending on the capacity of the people, for the simple reason that if you don't have money to buy the bus ticket to get to a health post or to a health center, and you don't have the money to buy the diagnostics, then you will not be treated appropriately. So there are several levels that imply social protection mechanism and that imply universal health coverage, as we like to call it. And then there is the notion of making sure that these services are equipped with well-trained people and with the laboratory access that is required to make the diagnosis.
So give us a sense of the global picture today. We understand that with HIV/AIDS, fighting tuberculosis has become even more difficult. Can you give us a sense of what is happening on the ground? What are the most affected areas?
Yeah, I mean, first of all, tuberculosis is everywhere. There is not one single country in the whole world, rich or poor, that has ever eliminated tuberculosis. These people people often ignore that. The extent of the disease is huge. We are talking nearly 9 million new cases every year and 1.3 million dying, I would say unnecessarily really, for a disease that is preventable and curable once it is detected. So the areas affected, of course, the developing countries are those of the poorest countries, are those most heavily affected. You have situation in Southern Africa with 1,000 cases per 100,000 people, meaning 1% of the population gets tuberculosis every year, compared to, say, what you have in the US or in Europe, where the rate is now 5, 10 or so per 100,000. There you have 1,000 per 100,000. So the burden is huge. And when you look at the populations, the big populations in Asia, like India, Indonesia, Philippines, China, and so on, there you have the largest number of cases.
Okay, Dr. Raviglione, unfortunately, we have to leave it there. Thank you so much for joining us today.
Thank you.
And that was Dr. Mario Raviglione, Director of the World Health Organization Global TB Program. He joins us via Skype from Geneva. That's our Africa 54 Health Report for today. Back to you, Vincent.
Well, Linord, thank you very much. Be sure to watch Linord Moudou's health updates every Tuesday and Thursday right here on Africa 54.